Friends, World Continence Week, 19th to 25th of June, is celebrated as an awareness to the society, where we spend time to spread awareness to one and all regarding the aspect of continence. And to me, as a urologist, continence is an important aspect in urine. So let's look into this continence aspect for the next 7 days, looking into day one today. Urinary incontinence is a huge burden on healthcare and in society. And unfortunately, a very silent burden. Many of us go through it. Many of us suffer temporarily. Many of us are on long-standing incontinence issues or leaking urine. Unfortunately, it's underreported. We don't report it out of the shame and agony that we go through, whom to report, whom not to report. It is only occasional. It is the everyday affair. And if we report, what kind of treatment? Can I talk about my urine to the doctor, etc., are kind of dilemmas which individual goes through. It could be young girl, it could be school-going girl, it could be college-going girl, it could be young woman, it could be a geriatric elderly postmenopausal woman, or it could be an elderly man or anybody on the street. It could be anybody in the society who is going through this trauma of not able to control urine. Very important for us to wake up to this phenomenon. Leakage of urine involuntarily, not able to control urine, is incontinence of urine. And it can have many connotations, many families of leakages of urine. So the World Incontinence Week, I would say, that means to bring about continence, is a celebration of fact that there's treatment available. There's cure available for incontinence of urine. So let's look at this Continence Week celebration by being ambassadors to a subject, looking forward to not have incontinence. And if anybody and everybody has it in the home, we would work hard towards taking this awareness to them, making them reach their right doctor and probably take it forward. So urine is a domain of a urologist, obviously a gynecologist, a urogynecologist, a physician, a doctor, whomsoever you see. A specialist would like to see that you are not into trouble and specializes to take care of the care and cure part and treating it like never before. So the women live with incontinence more than men. Elderly people live with incontinence more than youngsters. Children will live with incontinence and probably will be bedwetting at night or wetting their clothes in the school before the bell rings for the classroom. So many ways incontinence could hit. If we look at two large pictures of incontinence, which we discussed today on day one of the World Continence Week 2023, one is called the overactive bladder, where the bladder is at fault, the bladder to blame. What happens? The bladder is overactive. What does it mean? The bladder contracts erratically. It just decides to become a master. Till this time, we were masters and the bladder was a slave. We would decide when we would walk to the washroom, open the zip in the surroundings of our privacy. The brain would say, now you pass urine. The bladder would contract then at the command of the brain and everything that is in such good cohesion. And the urine would flow out through the passage. So bladder contracting, passage opening, urine coming out is something you and I go through daily umpteen times and for umpteen years in our lifetime. But yes, if the bladder becomes overactive, for the region which could not be known and called as idiopathic overactive bladder, that means the cause not known, thus the signals in the bladder have transformed to just become overactive, then situation could be that the bladder may just contract erratically, very involuntarily and unpredictably at a point in time of its choosing, where you could be in a queue, you could be in a bus, you could be working, or you could be in a situation where you just can't hold urine. So that increased frequency of urination by the bladder contracting erratically, sometimes precipitancy or urgency, that means a desire which is almost difficult to postpone, where you clutch your thighs, where you look at probably, de-stressing yourself because the stress is too much on the pelvis, on the lower passage where the bladder is almost trying to burst, giving you a feeling of urgency. If you're probably not able to hold that, you will end up with urge, incontinence, or leakage of urine. So this triad of increased frequency of urination, urgency, and urge incontinence in an individual, one or all the three, is called as overactive bladder. And this doesn't necessarily come with a disease process. Now, the overactivity of the bladder causing increased frequency, urgency, and urge incontinence can also happen in urinary tract infection. When you get an infection, the bladder is becoming very erratic, very painful, urgent. You got to go to the washroom very frequently. There's some burning and discomfort too. That's not an overactive bladder. That's an overactivity of the bladder as a result of an infection. For example, the prostate is obstructing the urinary passage gradually and progressively in an elderly gentleman. Progresses to such a level that he has ignored or he has postponed or he could not know that the progression was happening where the flow was gradually going down. The bladder is attempting to push urine out every day. Now the bladder becomes secondarily overactive to a closure. Like you start knocking the door very hard because the door is closed. So bladder is knocking extremely hard secondarily to an overactivity resulting as a result of obstruction to the flow of blood. Interstitial cystitis bladder pain syndrome, a situation where there's no infection, but the interstitium is inflamed. That pancystitis, where women suffer more than men and they complain of pain when the bladder fills up, makes them to go to pass urine more frequently. And that is something which in the region of the pelvis, discomfort, making you go to pass urine again and again, not able to hold urine with burning discomfort, which progresses day and night. You're woken up at night with your sleep waking you up in terms of pain, pain, pain. And then you go and pass urine and get relief. So relief when you empty your bladder and you learn a frequency or a force frequency by yourself because you don't want pain is a kind of overactivity developed as a result of pancystitis called interstitial cystitis bladder pain syndrome. So all these are overactivities of the bladder to brain. Let's go to another domain, which is the large domain, where many women in their prime of life, which could be postmenopausal, which could be after multiple childbirths, which could be age-related changes happening in the pelvic floor, the hammock, the pelvic floor may turn weaker. The urethra may become hypermobile. The passage is as such not able to handle, the pelvic floor is not able to handle the entire aspect of stress that is put to the pelvic floor, and that is called as stress incontinence. Contrary to the overactive bladder, where the bladder was to blame, where the bladder contracts erratically, the language in front, when the patient speaks that I've got urgency frequency, not able to hold urine, I have to rush. But doctor, my flow is very good. I don't have to worry about my speed of urine. My obstruction is not there, but I just can't hold. The bladder has become a complete master and I am a slave. If that is what it is, and you're leading a life on diapers, it's time to leave incontinence of that kind. Just compared to that, stress incontinence, which I did talk about, more common in women, or unfortunately exclusively in women, is about the pelvic floor being weak. The pelvic floor turns weak. It's a different pelvic floor in women compared to men. What happens? As a result of hormone changes in 30s, 40s, 50s, as a result of childbirth, vaginal deliveries, pelvic floor stretch. The female pelvis is more of a hammock, like hanging with its own composures, its own kind of various stretch aspects which have been maintained in early part of life. That may gradually weaken up with umpteen things happening around. The pelvic floor weakens, a result of hormone changes, by straining, by pushing, by multiple childbirths, deliveries, pelvic floor surgeries. There are umpteen factors which happen, and then gradual aging of pelvic floor in postmenopausal and elderly women of the mothers and grandmothers age group. All these could lead to a weakness in the pelvic floor where you can't control urine when you cough, when you jump, when you bend down for your prayers or namaz, when you actually climb down the stairs or climb up the stairs, run to catch a bus, or even sneeze and cough and even laugh. What does it mean? The stress is not mental. The stress is created mentally, but the stress incontinence term is a stress to the pelvic floor or the weakening hammock. And this can happen to post-pregnancy status where the pelvic floor has not recoiled into the elastic strength. It could happen to women. So today, on the first day of an awareness towards the Continence Week, which is celebrated more to make people aware, Awareness Week, is important for us to make you understand that women in the prime of life, men in the prime of life can have overactive bladder. Women suffer from stress incontinence, exclusively women's disease. Men can also have stress incontinence, which I would talk on one of the days in this week, which is so important. Friends, incontinence is something which is such a disability, which is such an agony, where people will not drink water. They would map the toilets. They would be constipated because they don't drink much water. The hygiene probably goes down. The urine is smelling more acidic and more dirty kind of smell, which you can't stand yourself. It's a pungent kind of smell happening around. And you are living with incontinence, and therefore you're worried about living with diapers. So friends, is it a time to live in incontinence rather than living with incontinence? That's an article which was published to make people aware last year on the Continence Week. And it's important for me to take it forward to the next level. As a urologist, my colleagues in urology across the country would look forward to healing wounds, caring for you, looking at your continence rather than living with incontinence. So it's important to wake up, important to speak up. Unless you take the health road to front row seat in a quality of life disease, which is called as incontinence, you continue to live with incontinence. You continue to live with increased frequency day and night. Nighttime frequency called nocturia is another domain altogether. You get up multiple times at night, more so by nocturnal polyuria or more production of urine at night. More so in elderly people who have got milder sleep, the arginine vasopressin mechanism is getting disturbed and people get up multiple times. Bedwetting, sadly, is a situation of incontinence in child, which is a milestone disorder. Up to 5 years of training by mother, the milestones are being met and the child is being continent in daytime, knows to open the undergarments and go to the washroom and empty the urine. But nighttime is completely out of his control. So milestone disorder called enuresis of bedwetting afflicts children between 6 to 15 years. And extremely important for us to be aware that this may progress in a subset of individuals beyond 15 years when they become adolescent and adults. Time for them to get their bedwetting sorted out, their morale sorted out, kind of thing. So, as I said, incontinence on day one of World Continence Week from 19th to 25th June, sorry, is actually an awareness drive into various domains of leakage of urine, which is an involuntary leakage that you don't know. It can happen to anybody. Remember, 9 to 43% of individuals in India have got some degree of incontinence at some point in time, or it could be a lifestyle phenomena. People live with it. So why not wake up today, be an ambassador to this subject over the next 1 week, and look at this 24/7, 365 days that we look at abolishing incontinence of urine, incontinence of feces, where fecal matter leaks. There are therapies available, from the tablets and medications in overactive bladder to botulinum toxin in the bladder, which could be given not every day, but once in 6 to 9 months to chemodenervate the bladder and keep the bladder more sane and under our control, to sacral neuromodulation, the wonderful therapy which keeps you dry and continent in the needy individuals of the right chosen patients, where an implant at the sacral level brings about a continence forever. And it's a state-of-art kind of a finding. Maybe a little expensive, but it changes your lifestyle completely. Your confidence, your capability, your calibration to the outer world changes completely. So sacral neuromodulation, a state-of-art of phenomena which has been brought about for us to implant a kind of a neuromodulation device, which is a microchip implanted like a pacemaker in the heart, implanted down back there in the sacral region, brings about a modulation of the neural fibers and brings about a control in urine. So there's so much to be done in incontinence of urine. So why not let's wake up, get a motto that we were living with incontinence, now no more. We are leaving incontinence in 2023 in this awareness of the World Continence Week. Friends, thank you so much. We'll tune in again and look at how does World Continence Week take us forward in various domains around. Let's not have anybody leaking urine after this 7 days of a vehement campaign that the world takes over. There's so much being discussed every year in this 1 week. Remember, we have got a day to celebrate or a day to make aware. If incontinence is such a huge burden, it may require so many domains to open up over a week. And therefore, a week of celebration, a week of awareness would probably put India and the world of incontinence to a different level altogether. Thank you so much.